good evening. My name is Mark Turner. I'm one of the co-directors of the International Neonatal Consortium, and welcome to our webinar about the culture of communication on neonatal units, the reporting of parallel stakeholder surveys, and a summary of results. All the presenters are ready to start, and all the attendees are on mute. So we'll listen to what people have got to say, listen to the panelists, and then invite questions and comments through the functions of the webinar. The background of this webinar is the need to improve drug development in newborn babies, and INC has taken many paths to that. As we pursued the paths about regulatory alignment and terminology and improving protocols, we recognized that one of the main barriers to conducting research and designing research is effective communication that listens to all the stakeholders involved in neonatal care. And so as we came to that realization that there were some major barriers to effective communication, some enthusiastic volunteers decided to think through communication, and led by Jennifer Daigle and Christina Bucci-Rexbeg, a working group has been toiling away for the past few months to conduct a survey about communication and about how that general communication on neonatal units fits in with research. And that survey has listened to the views of families, the views of nurses, the views of investigators, and we're going to hear the results of that in the next few minutes. So I'm looking forward to this interpretation of the results as well as the raw data, and we'll have an opportunity to ask questions, to think through the data, and also think through the interpretations and recommendations that the group have come up with. So we'd encourage you to submit questions at any time so that the panel participants can address those questions after the results presentation by Christina and the panel discussion, including a parent representative, a nursing representative, and a neonatal clinician representative. So just to move on to how we can ask questions in the next slide. The secret is to look at the bottom of your webinar screen where there's 3 dots next to each other labeled More Options. And as you press that button, then there's a Q&A question mark. And then when you come across the Q&A, please enter question here, and please send a question to all presenters so that the group can respond. So on this screen, we can see how the Q&A can be expanded or minimized with the down-facing arrowhead. And as I say, please ask all panelists and type your question here. And the questions will be collated, and then we'll feed them back to Christina and to panel members as appropriate. So please ask questions. Next slide. So everyone's on mute apart from the people who are going to present, and we're ready to ask questions. So the presenter this evening is Christina, who, as Global Head of Pediatric and Maternal Health Policy at Novartis, has co-led this group with Jennifer Daigle, mother of a micropreemie. So Christina, over to you.
Thank you so much, Mark, and thank you to the Critical Path for establishing this communications work group within the International Neonatal Consortium. As Mark said, our work group has undertaken the development of a parallel stakeholder survey, and as part of that survey process, we did assess 3 neonatal stakeholder groups Neonatologists and physician researchers were the first. Neonatal nurses and nurse researchers were the second, and NICU graduate parents were the third. And we did this to assess personal perspectives on research-related communication practices within neonatal intensive care units in our healthcare systems globally. So just to give an idea of what you'll hear over the course of the next 30 minutes, I'll provide a very high-level overview of the project itself. I'll lay out for you the survey construct that we put in place in order to conduct these surveys, and then I'll walk through the 6 survey domains that we assessed, the first being the overall demographic population, the second part being on the specific topic of role of research in the NICU, the third part being on how our respondents assess the current NICU communication flow within their NICUs. Part 4 was on our respondents' perspectives on the education and training of NICU personnel on the role of research. The 5th part is on our respondents' perspectives on the research consent process itself within their NICUs. And Part 6 of the survey was for our respondents to provide perspectives on the research results disclosure process within their institutions. I'll highlight 3 key limitations that we've identified as part of our analysis process at the end of the surveys. And then I'll also highlight where our communications work group sees the next steps as we move forward assessing the results that have come from the survey process. So just high level, our communications work group within the INC undertook a deliverable, which as I noted was to develop parallel multi-stakeholder surveys to identify communication practices in NICUs as it relates to neonatal research and research practice. For this communications work group, we do have 2 aims overall. The first is to facilitate the engagement of neonatal staff and parents around the discussions about neonatal clinical trials. And one of the other aims of our work group is to do so in an attempt to increase parental consent and participation in neonatal clinical research. So for this deliverable, we were specifically hoping to achieve 2 of 3 key objectives that we have within our communications work group. The first, specifically to evaluate the current communication practices in NICUs about research across the globe. And second, to identify communication challenges in NICUs that impede successful implementation of clinical research. The third objective of our communications work group will be discussed as part of the next steps at the end of this presentation. Now, as I mentioned, the construct of our surveys was that we developed 3 parallel stakeholder surveys, 1 for physicians, 1 for nurses, and 1 for parents. We collect data across 6 domains. I've already highlighted that within the discussion of the agenda, but just to remind you, they focused on the perspectives of the respondents on the role of research in the NICU, the current communication flow in the NICU, education and training of personnel on the role of neonatal research, the research consent process, and research results disclosure. For those who did not participate in the survey itself, and to orient you to what our respondents saw when they participated, the format utilized Likert-style questions, multiple choice questions, and a host of binary questions. And in addition, there were 2 free text questions. Overall, within the survey itself, the physician survey and nurse survey had 105 questions matched, and the parent survey had 63 questions matched. We did utilize logic throughout the survey in order to ensure that if certain questions were answered in a specific manner, for example, if a respondent answered that their child did not participate in research, they would not have seen the questions that came up as a part of the research consent process or the research results disclosure. So the maximum number of questions would have been 105 for the professional respondents and 63 for our parent respondents. Within the survey as well, because we were assessing respondents from across the globe, where we had pre-identified that there may be some differences in how certain terms are utilized across these NICUs, we did provide a survey definition for those terms for our respondents to understand how they should answer the questions. So as you watch these slides, I want to orient you to how you'll see information on the slides themselves. At the header of each results slide, you'll see the take-home message that our communications work group has identified. Then, for the tables and figures, we will always present the data in the order of the physician data first, the nurse data second, and the parent data third, so left to right, physicians, nurses, parents. The actual survey questions that we use in the survey will be provided down in the footnotes, as well as any special instructions. And then the domain of the results that I'm highlighting will be provided for you in the bottom right-hand corner. So let's go. Let's talk about what we found. So the demography of our respondents. Overall, in the survey, we had 52 physicians, 188 nurses, and 83 parents enter the survey through the SurveyMonkey tool. Most of our respondents were from English language predominant nations, with physicians well balanced between the U.S. and the EU, and for the nurse and parent groups, the large majority of our respondents being from the United States. We also found that within our survey cohort that our respondents were generally very well educated, with our nurses demonstrating either bachelor's, master's, and also doctorate degrees, and our parent groups demonstrating the majority holding either bachelor's or master's degrees. The majority of our respondents across the three stakeholder groups define the level of care in their hospital or NICU as providing either level 3 or level 4 care. You can see level 3 in gray and level 4 in yellow. For the physician and nurse-specific demography data, there was a diversity of current NICU positions represented in both of these stakeholder respondent groups. You can see the physician data on the left and the nurse data on the right. And what we found is that more of our physicians and nurses reported that their current role requires both direct patient care and research responsibilities. That data is found in gray in the physician pie chart. Whereas for our nurses, what we found is that while a portion provided both direct patient care and research responsibilities a part of their role, there was a large proportion who actually provide as part of their role informal research responsibilities. For the parent-specific demography data, we found that the majority of our parent respondents were generally older when their child was cared for in the NICU, with the majority having been between 25 and 34 years of age, and a proportion being between 35 and 44 years of age. In addition, a large portion of our parent respondents had wide variability in the time since their child was cared for in the NICU, but the majority having had their children cared for more than 2 years prior to participating in this survey. Okay, so for the first part of our data related to role of research at the neonatal intensive care unit, we found that physicians, nurses, and parents alike all embrace the concept of research as core to the NICU mission. And where you see the blue bars, this notes that the physicians or the nurses or the parents in general agreed that research is core to the NICU mission. When we went on to ask the respondents about their specific NICU's mission, we found that a smaller proportion of nurses and parents, as compared to physicians, found that research is a central component of their NICU's mission. And importantly, we found that a larger proportion of parents were unsure of the role that research played within their NICU's mission. We assessed the perceptions between the survey cohorts on the need for and the approaches to neonatal research. And what we found was that a larger proportion of the physicians surveyed felt that a study is necessary to determine if a drug is safe and effective in sick newborns, even after the drug's efficacy and safety have been demonstrated in adults. And when we looked at across the cohorts, we found that nurses and parents, a larger proportion felt that an additional smaller study is necessary to determine dosing and to evaluate the safety of a drug in sick newborns after the drug's safety and efficacy have been demonstrated in adults. An overwhelming proportion of physicians in relation to nurses and parents do not feel that existing medications are sufficient to meet the medical needs of sick newborns. And for this question, you would want to look at the orange bars. So here's the physician data, the nurse data, and the parent data. But importantly, what we found was that for each of the stakeholder groups, there was a proportion that were neutral on this question. So on the topic of the current communication flow in the NICU of the individual respondent, what we found for the physicians and nurses is that family-centered care is common. And we asked questions around family-centered care in relation to parental presence and interaction with the medical team and their infant. And so for this specific question, when families are fully engaged, my NICU includes families in developing the plan of care for the sick newborn, we found that the majority of our neonatologists in blue and nurses in orange either agree or strongly agree. And while family-centered care was also felt to be common amongst the parent respondents, we did find that 20% of the parents responded that they were never or rarely offered meetings with the neonatal team caring for their newborn. And what I am going to ask is, we can hear someone talking in the background, so if you're not sure if your line is muted, please now take this opportunity to do so. So again, 20% of the parents that were assessed responded that they were never or rarely offered meetings with the neonatal team caring for their newborn. We also assessed on a series of questions perceptions related to the current methods of communication about either ongoing or upcoming research involving neonates within an institution. So when we asked the question, does your NICU have a central source for information regarding ongoing or upcoming neonatal research in the NICU, we found that more physicians than nurses noted that they felt there was a central source for this information in their NICUs. Then we asked questions specific to ongoing research, where we assessed if the nurses and physicians felt that their NICU had a system in place to provide updates to families about ongoing neonatal research in the NICU. And more nurses than physicians felt that there was no system in place to provide this information to families, though there was a proportion of both the physician and nurse groups that were unsure. Then we asked the question, does your NICU have a system in place to provide updates to families about upcoming neonatal research in the NICU? We had a more even spread of physicians and nurses who did not feel that system was in place, but many more physicians than nurses who felt that there was a system in place to speak to upcoming neonatal research in the NICU. For both of these surveyed populations, we wanted to go on to ask further questions to those respondents who had noted that there is in fact a system within their institution to provide updates to families about either ongoing research, so these were smaller cohorts, or upcoming research. And these smaller cohorts noted amongst the physicians that specific meetings to discuss research and contact from research personnel are the most effective means to communicate about ongoing research. When we asked the nurses, they additionally felt that staff meetings in relation to other sources of information, but in addition to specific meetings to discuss research and contact from research staff, were the most effective means to update the nurse groups and communicate about ongoing research. When we asked the same series of questions related to upcoming research, our physicians who had a central system in place noted that staff meetings, specific meetings to discuss research, and contact from research staff were the most effective means to discuss upcoming research, and nurses had a similar response. So then the next part of our survey was in regards to education and training of neonatal personnel on the role of neonatal research. It's important to note that this part of our survey was only provided to the physician and nurse respondents. And it's also important to note that in reviewing the data after the survey data was tallied, we identified that there had been a technical issue within the platform, which only allowed the physicians to see the first question in the survey. So the majority of the data for Part 4 will be from our nurse respondents. We did ask a question related to whether or not the NICU or hospital trains personnel on the role of clinical studies in the study consent process. And what we found is that while institution-based training regarding research is available, there's a gap in perception between physicians and nurses on its actual availability to the staff itself. And the majority of nurses felt that their training, either professional training or institutional training, would support their ability to participate in research activities in the NICU, though there was variability regarding its effectiveness, with yellow being effective, blue being very effective. And only a small proportion of nurses reported that they are asked to provide input into study conduct at their hospital, with the blue colors being the data representing that note. We also found that there was a large proportion of the nurses who were neutral in relation to this question. When we surveyed the 3 stakeholder groups related to whether or not the institution includes NICU graduate families and research education and training programs for current NICU parents, we found that healthcare providers and parent perceptions differ widely regarding the inclusion of NICU graduate parents in research education or training programs, with 70% of the parent respondents saying this never happens in their NICU, and only a small proportion noting this amongst the physician and nurse groups. So this section now talks about the perceptions of our respondents on the research consent process. And we found a small proportion of professional respondents noted that consent for study participation is always, in light blue, or usually in dark blue, sought from families before the birth of a sick newborn. We did, however, find that a very large proportion of the nurses were unsure whether or not this takes place within their institution. A small proportion of professional respondents noted that consent for study participation is always or usually obtained in advance of anticipated events, with always being in light blue and usually being in gray. And similar to the previous question, we found that a large proportion of nurses were unsure whether or not consent for study participation is obtained in advance of anticipated events. We further surveyed only those parents who had provided consent for their baby's trial participation during their stay in the NICU. And we found that 1/3 of the parent respondents who gave consent for trial participation did not feel it was clear where they could obtain more information about the study. Then we assessed finally in the survey the research results disclosure. And what we found is that respondents agreed that study results should be made available to families upon study completion, with the parents in gray, the nurses in orange, and the physicians in blue. Only 1/3 of professional respondents noted that their institution has a standard approach in place to provide study results to parents, with the data from the physician group and the nurse group being quite similar. However, results were discordant between physician and nurse respondents on whether there is a standard approach in place to maintain parental contact information at their institution, with 60% of physicians versus 34% of nurses. And finally, we assessed the parents who had participated for their baby's trial participation while during their stay in the NICU. And what we found from this small cohort is that the overwhelming majority of parents were not informed or advised about the plan for results disclosure. And this was in relation to the question, when I was approached to consent for my baby's study participation, the plan for how results would be provided was discussed. Approximately 70% of the parents said no. We were given an option whether we wanted to receive the study results. Again, similar outcome. We were given an option for the method that would be used to provide study results. Again, a similar response. We were notified who would be providing the final study results to us. Again, a similar response. And when our baby completed participation in the study, we were asked to provide up-to-date contact information. Again, a similar response. So now I'd like to walk through what we've identified as the limitations for this survey. First, in relation to the survey sample, we do acknowledge that the sample is small and therefore the results should be tempered when we think about the broader application. In addition, we developed the survey in the English language, and therefore the regional distribution of the respondents reflects largely English-predominant nations. This was also a convenient sample of our INC membership and their networks, which may reflect why our cohorts are quite well educated and have a large proportion with research exposure. A second limitation is in relation to the survey development process. We had a very lean survey development team and very few physician contributors in the survey content development. That's now quite different as we're reviewing and analyzing our data in the post hoc. In addition, we conducted an unstructured literature review that informed our domain selection. And finally, because we had no direct funding, we were not able to conduct psychometric testing on item and or survey measures. And while we did have a pre-specified statistical analysis plan, because we had no direct funding and we anticipated a small sample, we utilized descriptive statistics only, and no bivariate or multivariate analyses were conducted, so we can only report on trend. So our next steps. We've presented to you today the results that underscore the 15 key messages that we've identified within the survey itself. And as a part of our analysis process, we brainstormed potential action planning around the key messages that we've identified. And we've begun a high-level discussion around what that could look like in terms of action planning. As a result, we've identified 3 overarching themes that may prove to be opportunities for action. These include education and training, advocacy, and improvement in the communication flow in NICUs. Our immediate next steps are in relation to how we'll share this data. The first is that we have 5 manuscripts that are in progress so that we can share the survey results. To do so, we have the 5 papers will be the first providing the primary results. The second, which will analyze our survey development process and our key lessons learned. And then we'll have a physician, nurse, and parent-specific paper in order to cover our key stakeholders who were relevant to both our survey analysis and hopefully our future action planning. Data is available, and therefore we can plan for abstract development for submission for professional societies and their parent advocacy meetings. And this data is held by the Critical Path INC, and therefore the data and the data sets are available within the INC Communications Workgroup SharePoint. So before I turn things over to Mark for our panel, I'd really like to extend a huge thank you to our Communications Workgroup, all of whom are listed here below. This progress that we've made on this project over the course of the last 2.5 years would not have been possible without the commitment of not only our original members, but our members who have been really active and engaged in the process of analyzing our data and ultimately developing key messages in our manuscripts and our future actions. So a very specific thank you to Jennifer Daigle, who's been a spectacular co-chair, balancing her full-time day job as a science teacher, being a mom, and just really being a wonderful champion for parents of babies in the NICU. I'd like to also highlight the role that Mary Short has played in helping us to advance and develop our content for the webinar itself. And then a very specific thank you to Laura and Sarah, without whom all of our multiple activities, we would never be able to move forward, and I'm sure it's consuming a large portion of your day job. So a very special thank you to you. And then Mark, I'm going to turn things back over to you.
Great, thank you very much. Thank you, Christina, and thank you, Jennifer, and thank you, Mary, for putting together such a clear and concise presentation that covers many complicated areas. Can I just encourage everybody to send some questions or comments? You may want to talk about the data, you may want to talk about the messages, you may want to talk about the next steps, but please send your questions and answers using the 3 small dots on the button as shown on the screen, and please submit your question to all panelists so that we can put them in order and take everybody through the information that you want to explore. So please send some questions. So here we go. Here's how to do it again. Use the 3 buttons, then maximize the question and answer, then send to all panelists and type your question. And we look forward to receiving the questions. Now we're going to listen to the people who have been asked to comment, who had a central part in the design and conduct of the surveys. First of all, we're going to hear from Jennifer Daigle. As Christina said, Jennifer's a teacher, the mother of a micro-preemie who has inspired all of this work by reinforcing the importance of listening to families at every step of the research process. Then we'll hear from Carol. Carol Kerner is Professor of Nursing and a Dean of a School of Nursing, Health and Exercise Science. For many years, Carol was President, Chief Executive, Animator of the Council for International Neonatal Nurses, and has guided us and her professional group in many ways through that vantage point. Thirdly, we'll have comments from Kelly Wade, who's an attending physician on the neonatal unit and a prominent researcher in our community. And also, as a special extra surprise, we'll have a comment from a nurse/stroke industry perspective, as Mary Short is able to join us and give her views from the driving seat of analysis and preparation of presentation. So please send some questions, and we can then incorporate those into the discussion that will follow after each of our panelists. So, Jennifer, what are your thoughts and reflections? What are your take-home messages, your comments? Thank you, Jennifer.
Thanks, Mark. So, as Christina mentioned before, and Mark, my daughter was born at 23 weeks gestation and spent 121 days in the NICU. So I come to all of this from that perspective. But I do share the perspective with many other NICU parents. And from our side, there's really 4 components that Christina really did explain in great detail, but I'll just highlight some of that from the parent perspective here. The first thing I want to talk about is that the majority of the parent responders are in agreement that research should be a central component of a NICU's mission, vision, and goals, yet a much smaller portion of the parents felt that it actually is a central component of the NICU mission of where their baby was. So I think there's a disconnect there that can lead to some misunderstandings surrounding the importance of research in the NICU. And if parents don't believe that the research is a very important part of the NICU mission when their baby is there, they may not be behind it 100%. So I see this as our first opportunity to develop some better communication between parents, the researchers, and the physicians. I also feel it's important to mention that 20% of the parents responded that they were rarely or never offered meetings with their baby's care team while their baby was in the NICU. And that's another opportunity, for physicians and nurses from the survey to take this information back to their hospitals and advocate for better communication with parents. I do want to quickly mention that the majority of the parents responded that the graduate families do not participate as teachers in education or help training and programs for the NICU parents. And I have a lot to say about that, but I'll just say that I think that we're missing a great opportunity here for NICU graduate parents to share their experiences with the current NICU parents, and I think that can ease a lot of the stress of a NICU stay on those parents and answer questions regarding what comes after discharge, because I often get that question myself from other parents. And the last thing I want to highlight is that I really feel it's important to mention that the majority of the parent responders who actually did have a baby that participated in a trial basically reported that they were not asked how they would like to receive results, if they wanted to receive them, or where they could find their results on their own at the completion of a study. And I think this, again, really doesn't help, show the parents that research is so important and a central component of the NICU. If they're not offered, not offering results back to them or any place they can find the summaries or findings. So I really think that's a super important part that we can all take away from that, is that we need to communicate better to our parents and get their needs and see how they want to receive information. And I think those are the biggest highlights from the parent perspective.
Great, thank you, Jennifer. And those are some pretty hard-hitting points that we all need to incorporate into our practice, and we need to disseminate so that everybody else is learning from those lessons as well. So thank you very much. Moving on to Carol, what are your reflections, comments, and plans?
Thank you, Mark. Well, I think Christina did a great job of highlighting the differences, especially, or the discrepancies differences in perceptions, especially among the health professionals and with the parents. I guess having been a nurse researcher and an educator and a staff nurse in my various roles, I was not surprised of some of the results. But the key messages to me are, and I think our working group, especially on the nursing paper, have described this as the fact that the role of research is not always clear to the average nurse. They may not be involved in the communication, and that was another key piece, that the communication flow among the healthcare team, including the parents, is not clear to nurses. What their role is in that communication flow is not always clear. So they perceive a lack of a systematic method of communicating either upcoming studies, ongoing studies, or studies that have finished. And that carries through, I think, with the points that Jennifer was making from the parent perspective of the dissemination of the information, dissemination to parents, and also if the nurse is not intimately involved in the research project, that they, from the results we got, didn't always know the dissemination pathway. So I think that is a teachable moment for all of us in terms of looking at that communication from the beginning of the study to the end and dissemination. The research consenting process, I think, again, points out the fact that especially the nurses were not certain about that consenting process. Some of it may be that in many units they're not really involved in that. But again, it has to do with the communication. When studies are going on in the unit, they may not be involved in the consenting process. As far as the education and training, and I think that this way is where there's work to be done in the future, is that while some nurses clearly saw that there was education and training available, there were a good number that didn't really know about the training in terms of research and the research process and the consenting process. So again, I think that is a gap in not only in the perception or the difference between neonatologists and nurses, but a gap in terms of our communication and how we can better prepare nurses and in the future as far as the research process. Research results I mentioned before, I think, is another key area of how do we disseminate those results and how do nurses get that dissemination. While they said that some of the research is better, they learn more in a staff meeting. I know as a researcher myself, I used to have staff meetings after a study was finished so that I could present the findings and get their input, but that doesn't always happen, at least as presented from these results. So that is another area that I think we need to explore next. Thank you.
Thank you, Carol, for summarizing all those important points that, again, we need to incorporate into our daily practice as clinicians and as researchers, but also capture and disseminate. And I hope the nursing paper that will come out of this will spread that word very clearly. So thank you, Carol. Moving on to Kelly, what are your thoughts and reflections?
Well, thank you, Mark, and thank you, Jennifer and Carol, for highlighting those important points of the parents and nurses. I've been working with the physician group on our response to this data, and I think what was most exciting is that the survey really affirmed the value of research in the newborn ICU, but at the same time it highlighted the unmet need for medications for neonatal conditions. It was striking that nearly all physicians reported that the currently available medications were insufficient to meet the needs of newborns today. And we all know that only through rigorous research on both old medicines and new medicines can we actually provide safe and effective care and improve the outcomes that we so desire. It's reassuring, however, that all stakeholders, nurses, parents, and physicians alike, really endorse the role of research as a central vision and goal in the NICU. With this strong endorsement of research, though, clearly we need to foster this positive culture of research in the NICU, and that will come through communication. In terms of the importance of the communication practices that bring together all providers and parents, I think what I took away is we need to listen and discuss the research studies of the past, present, and future with all of these important stakeholders in the room together. The communication piece that stood out the most to me was the research results disclosure. And clearly we've not paid enough attention to how to release results of studies to parents. And in fact, I believe that all stakeholders, everyone in the NICU, would benefit from receiving study updates and general study results. I think this is something we don't do enough of. For parents, the results disclosure can be part of an initial consent process, but also part of the NICU discharge process, neurodevelopmental follow-up visits, and even at the time of study completion. But we need more information from families and nurses about how to provide this information and how to support families when they receive this information. I think it's also helpful to include everyone in the NICU, nurses, parents, care providers alike, in sharing research study milestones, things such as the completion of study enrollment when a trial finishes enrolling their last subject, the completion of study activities for all patients in a multi-center trial, and the presentation or publication of results. I really think this would help build a positive culture in the NICU and recognize the important part that all care providers and parents and infants play as we conduct research. If there is a safety concern in a trial or a trial closes prematurely, then this too is an opportunity for transparency and education. We also learned that with this strong endorsement of research, we need to amplify our education about the safety measures that exist to protect infants who are participating in research. And although we didn't have time to cover the data in today's presentation, the survey did probe respondents' understanding of a variety of safety measures. And these safety measures that are that are ongoing to protect sick newborns enrolled in research studies were not uniformly understood by respondents of the survey. The parent group were the least confident in safety, protections, and oversight of research, with only 44% of parents reporting sufficient protections and 28% of parents reporting that they were unsure of the protections that were present. So in this area, I really think that sharing stories of past research that highlights examples of where safety mechanisms, data safety monitoring boards, and protocol designs have protected infants. Additionally, to share examples of how research studies have demonstrated that an historically accepted practice or medication was actually not safe or effective when studied. And we need to be forthright about the innovations in clinical trial designs to meet the specific characteristics or limitations of our babies, particularly our smallest babies. And finally, as I'm just beginning to delve into an area, we need to consider this area of growing body of evidence that demonstrates improved patient outcomes in hospitals that perform research. Those are the three things that really stood out to me and the physician group I'm working with, but we certainly want to highlight that beyond these specific messages, the survey, I think, really demonstrates the power of bringing all stakeholders together to solve difficult problems. And for that, I'd really like to thank the INC for its leadership and also for ensuring that parents, nurses, physicians, and providers of care in the NICU are included in this effort.